Okay, today I'm going to talk about common chronic postural issues and possible solutions. My goal today is to share my experiences with you all, experiences that is with some really common issues that I've seen in individuals and athletes, from youth athletes to elderly, geriatric, general population. And, these are items that we can actually do quite a bit about through the training movements that we choose and recovery strategies that we implement. I just think it's sort of low-hanging fruit, some easy things for us to make a big impact. And just a reminder, I'm not a doctor. This is not medical advice. This is simply me pushing the theories other people created that I seem to be finding to be true. And I'll also throw in some personal experience as well. So the first issue I want to discuss today is kyphosis. So if you look at the image on your left of the normal spine versus the kyphotic spine to the right of that, that's an upper body or upper spine curvature that's a little unnatural. And it can occur for many reasons, but we're actually able to have a pretty big impact on this, and we'll talk about that more. And if you ever see anybody kind of looking like the Hunchback of Notre Dame, where their head is forward and their shoulders are rolling in and things like that, then you might have some kyphosis on your hands. It also goes by the nickname the eye hunch. So as technology has advanced, and as technology has advanced, and we spend more and more time on our cell phones and our laptops and driving our cars and things like that, we spend more and more time at this poor posture. So not only does it not look so great, but it can also cause pain, and it can decrease sport performance. And it's just something that we need to keep an eye out for. And what I really want to call this problem is upper cross syndrome. So for the rest of the day, that's kind of what we're going to call it, is that upper cross syndrome. Upper cross syndrome, notice that those two red lines are creating sort of an X or a cross. And there's two tight spots and two weak spots in that upper body. They're creating and causing this poor posture. We have tight upper traps and levator scapula. We have tight pectorals. We have weak, deep neck flexors. We have weak lower traps and serratus anterior. Okay, following that just a little bit more, all I've really done is typed up the words from that image. There's no new information in there. Just want to put it into a chart so that I could then put an example exercise with each of them. And we're also going to spend some time just refreshing our anatomy here. Upper trap there, levator scapula there. So those deep neck flexors will be the scalenes from what I have seen and read. The middle scalene is actually the most important, but I don't know, for the activities that I'm going to share today, I don't know that they're actually going to activate your middle scalene more than the other two scalenes. I can't say that. So when we want to correct movement, sometimes we're going to inhibit muscles and sometimes we're going to activate muscles. So all we're doing is taking sort of a step-by-step look at how to do that. Where's our serratus anterior get to? Serratus anterior. All right. And for our sake today, we're going to leave this slide behind, and we're going to jump over into the weight room, and we're going to demo these movements, and then we'll be back on the slides. Okay, so for our muscle we're going to inhibit, we want to inhibit the upper trap, the levator scapula, and the pecs. So for that upper trap, I would recommend a barbell mash. And simply raising a barbell up to a good height, appropriate height to access those traps. And your barbell sleeve is going to roll, so you can use that to our advantage. Just going to get under there, and I can pull down on it and add pressure. We're going to work that muscle to just help it relax, not so active, not so ready to fire every time I want to move. Inhibiting. And I like Dr. Kelly Starrett, he's a physical therapist, and his recommendation is to utilize 2 minutes per movement of a stretch, or whether it's a myofascial release or a static stretch. So anytime you're on that, set a timer for 2 minutes and just work on that. Next up, we've got the levator scapula, levator scapula. And it's kind of a sneaky one that runs laterally from the side of the neck down onto the scapula. So yes, you're going to have to go kind of through the trap a little bit to get to it. If you're going to go up on the neck, I would encourage you to be really tentative. As far as you've just got so much important stuff in there, I just wouldn't get too aggressive on that neck. So you can use the ball on the wall. So that ball is behind me, and I'm just kind of work into that muscle, that pathway, at least where it's supposed to be the most. If I'm going up on my neck, I'm just being tentative and slow. Yeah. If you don't have a ball, or if you want to do something different, a Theracane is also going to be nice to help get those other angles. And then last one, we've got the pecs. At 6 foot, I can walk into most door frames and kind of lean through and get a pretty good stretch right there. But another easy way to do it is just go one arm at a time. Just lean into it, open up the stinky armpit, air that sucker out, and just feel that peg getting a good stretch. Hang out for 2 minutes. 2 minutes there, over the other side, 2 minutes over there. That's inhibiting muscles for the upper cross syndrome. Now, what muscles are we going to activate for the upper cross syndrome? Let me look at my cheat sheet real quick. We're doing chin tucks, neck nods, Y exercises, and straight arm punches. Okay. So for the chin, we've got those scaling muscles in there that we want to get firing. So think about an individual here. It's kind of funny. It's not muscles back here that bring it back to center. It's muscles in here that will tighten and shorten and help us get more of a neutral back. Now there's some muscles firing back there, don't get me wrong, but it's right here. Those are getting elongated and we're shortening, right? So from a short position here, you can simply perform some movements like that. Another way would be, let's see if I can get a good angle going here. I'm gonna try. I'll bring this in a little bit more. Let's see if we can get that right there. Sorry, technical difficulties. Okay, I'm going with it right here. on these chin tucks, my head is not actually leaving the bench. I'm not doing crunches with my neck, because remember, your neck is already spending too much time in that forward posture. So doing neck crunches would activate your sternocleidomastoid, would likely not help. What we really want to do is tuck that chin, point top of our head away from us. You can also do endurance holds for longer reps. I can tell that actually would help me out a little bit. Okay, so we did chin tucks, neck nods. We need to do some Y movements for our lower traps. And you can do those while I've got the bench here. I kind of like that setup for you guys. While we're here already. What I'm gonna do is I'm gonna just relax. I'm gonna pull my shoulder blades, retract my shoulder blades back. Straight arms are gonna come up into a Y position. Let's see if we can get a little bit better angle going here. Okay. So I'm gonna retract my shoulder blades back, move into a Y position, and relax back down. And then relax my shoulder blades as well. So that retraction and protraction of my shoulder blades is gonna help activate my lower traps. And then when I go into that Y position, I feel them activate even more. And a coaching cue I would advise would be to have athletes or clients bring their shoulder blades together and then try to put them in your back pockets. I didn't make that one up, but I forget who I stole it from, but I really like that cue. And what's my last movement? Gotta check my cheat sheet again. Okay, straight arm punches. All right, I like this one. So we've got to hit our serratus anterior, okay? So on muscle magazines, when you see people have all those like shredded little muscles through here, that's your serratus anterior. So from that shoulder blade forward and attaching on your ribs, well, that's going to help with, think about when those muscles tighten, it's going to pull your shoulder blade down and in here, okay? So it's a stabilizer. It's going to help us out quite a bit. And sporting activities and heavy lifting, we like that muscle. Now, lots of ways to train it. You could lay on your back on the ground and do presses right there. You could do push-ups, both hands on the ground, and do work right there. But I really like the ball. I like doing ball punches because not only am I getting that motion, but I'm also going to get some stability because that ball is going to want to kick my hand out in different directions. Right here, punch in and relax and repeat. So those are some exercises to help with upper cross syndrome. Okay, so taking one more look at our slide there, those are the exercises we went over, and that's why we did them. We're not reinventing the wheel here. We're just taking a look at the problem, some of the issues correlated to the problem, and then we're trying to resolve those issues. And before we leave the upper cross syndrome subject, I really just wanted to bring up push-pull ratio. Looking at pushes as chest and shoulder dominant exercises and pulls as upper back dominant exercises, be thinking about how we can essentially correct posture with exercise. We don't need to have people walk around with a book on top of their head and do any like weird bouncing movements there. But if you look at a lot of athletes and you think about what they do in their daily lives, if it's a soccer player, they might go to practice and during warm-ups, they do 25 push-ups, and then they're doing some drills and they get in trouble, or some of the punishment is to do more push-ups. And then it's the weekend and they want to work out and they don't really know what else to do. So they decide to do a bunch of push-ups because push-ups are good for us, right? And then they go to the gym and they do like 3 sets of 5 pull-ups. Okay, so maybe our ratio of push to pull is now something like 150 per week to like 15. It might be a 10-to-1 push to pull ratio. Well, looking at all the posture issues that we have and thinking about how often people might do push-ups and other presses in sport or during practices, maybe consider doing more pulling than pushing. The only sports that are really even would be wrestling and swimming. Wrestling's about even with the pushing and pulling that occurs in the sport, with swimming being actually pull dominant because they're constantly pulling that water towards them. With the except the butterfly would be a little bit more chest dominant. But wrestlers, if you ever go and watch a wrestling practice, push-ups are a big part of it. So now they've got pull-up bars in the wrestling room, but does that mean that they're doing as many or more pull-ups than they are push-ups? Probably not. So I would encourage you guys to think about putting a big emphasis on pulling because it's just going to benefit our lifters to have better posture and to work on counterbalancing what is probably an overdeveloped chest or shoulders because of almost lifelong emphasis on pushing. So just something to think about. And just like we've got the kyphosis for the upper body, we've got lordosis for the lower body. It's a little bit of a exaggerated lumbar curve. You see the image on the left of the human spine, and you see the horse on the right with the sway back, I believe it's called. All right, lower cross syndrome. Again, 2 areas are tight, 2 areas are weak and need to be strengthened. Tight area number 1 is the lumbar and erector spinae, so your lower back. Tight area number 2 would be the rectus femoris iliopsoas, so our quads and our hip flexors. And our weak areas are going to be the rectus abdominis, or our abs. And weak area number 2 is going to be the glute max and glute med. Again, just typing up what we see in the image. And now example exercises for each of those. And I realize you guys can read. I don't mean to insult anybody, but I just want to make sure that you guys are kind of connecting the dots here. I want you to understand where everything is. So I didn't do a great job of including a quad and a hip flexor images on this diagram here, but just that quad is in the front of your thigh down here, and then your hip flexors help flex your hip across that joint there. So please cut me some slack there. I apologize. All right, we're gonna do 3 and 3 here, right? Glute max, glute med. There we go. And number 4, rectus abdominis, the dinosaur, the old dinosaur, rectus abdominis. All right, so looking at glute max and glute med, very, very similar location on these muscles, but look, they've got different origins and insertions. They sit in different places, they do different things. Don't get me wrong, they work together very often. And as you're working one, there's a very good chance that you're activating the other one. But they have different jobs, they are different muscles. I'm a father of 2 children. And being at the hospital when these kids are first being born and delivered, it really strikes you that new babies have butts on them. And my daughter was a scrawny kind of underweight thing, and my son was sort of a bruiser heavyweight. And my scrawny little daughter, even she had a booty on her. And then that thick son who came out at 9 pounds 10 ounces, even though he was already a heavy hitter, he still had a big butt on him. We're born with big butts because we're supposed to be using them and being active with them. And great athletes that I've worked with tend to have active and strong glutes. If you're looking for one thing to strengthen and activate on athletes, the glutes are not a bad place to start. Kind of funny, I get it, that's your butt. It's important. If you want to look into somebody who has made a living off of it, look at Dr. Brett Contreras, who has nicknamed himself the glute guy. And he's dove into research and created research surrounding this and the importance of the glutes and ways to train them and things like that. And from what I understand, he's making a living off of it, and he's actually adding to the science of our field. So Brett Contreras, the glute guy. Let's go do some exercises here. All right, here we go. Okay, so just running through some quick examples of exercises that you could do for lower cross syndrome. And one of my favorites that I'll start out with is the pretzel. And if you think about the issues that are associated with the lower back, now lower back is tight. Yes, there are muscles that run through there, but think about maybe an image of just a huge giant bodybuilder, besides me, obviously, in that they might have all these big, bulky muscles everywhere, but when you get to their lower back, for the most part, it just really slims down there. In fact, that's part of the look that they're going for. I think it's called a V taper, kind of like an hourglass figure a little bit. Not a whole lot of muscle in the lower back. So sometimes, yes, you want to address the localized tissue, not lower back, but sometimes you actually just want to spend a little bit more time on the muscles surrounding it and on the joints surrounding it. So I think that's why the pretzel is a great starting point when you're trying to inhibit and stretch your lower back, your erector spine. So on the pretzel, start laying on your side. Top knee forward and down, bottom hand grabs in behind that top knee. Top hand kind of grabs the crook of your ankle of your bottom leg. And the number one thing that I coach on this is to move that bottom knee back more. So people will keep that knee forward, and then they'll kind of rotate and say, I don't know what's going on. Well, I say, keep that front knee down, pinned to the ground, and open up that back knee. And then now let me see how far you go. And it's not as far. Now that we're in position, a couple of regular breaths. A big breath down in your belly. And then slowly exhale that belly breath as you rotate back and try to touch your top shoulder to the ground back behind you. Once you run out of air, reset. And what I would do is I would spend 1 minute on each side, gathering 1 minute of stretch time. Now, 1 minute on each side, that gets you 2 minutes total. I'd use that as a minimum approach. And then returning to, I was talking about Dr. Kelly Starrett earlier. I don't know if he invented it, but he has popularized it. It's the couch stretch. So I'm going to use a bench, but you could just as easily use a couch in your TV room while you're relaxing and watching your shows. Watching Magnum PI or whatever your kids are into these days. Get a great quad stretch here. If I squeeze that hip flexor, I don't want to arch to try to get my hip flexor. I don't want to do a big arch. If I squeeze my hip flexor, that's going to drive my hip forward. Yeah, just squeezing and activating that glute. it really, really fires up that hip flexor. I know I need to do that more often. 2 minutes per hold there. Okay, so now we're looking to activate. Those are a couple of stretches to do some good inhibitions for lower cross syndrome, but for activation, when we want to do glute max is associated with hip extension. So a single leg squat pattern can be great. All right, just right there. So my hip is flexed, hip is now extended, right? It's a wonderful thing. So that's my glute max, would be a single leg squat pattern like that would probably do the trick. That was a rear foot elevated split squat. And for the glute med, we want to do some rotations and just a fire hydrant, something simple like that. Just a fire hydrant there. Last area we want to worry about is our six pack, right? Our rectus abdominis. Rectus abdominis' job when contracting would actually flex the spine. I'm not going to do a big spiel right now about the dangers of spinal flexion, but if you get a chance to learn from Stuart McGill, which I'll also be making a Stuart McGill video, we'll be going over that. You'll know that there's a lot of issues associated with maybe high volume sit-ups and things like that, crunches. So if we want to work a flexion muscle, a spinal flexion muscle, but we don't want the spine to undergo high repetitions of flexion, a plank is a great approach. And what we'll actually be looking at, the effect there is actually be anti-flexion. So gravity is going to want to pull me down. But because my rectus abdominis is firing, I'm not sagging downward. So it's performing anti-flexion right now. And when I'm doing a plank, when I'm coaching a plank, I coach three things: tight butt, tight belly, and elbows right back to get the lats fired up. So those are example exercises for lower cross syndrome. Okay, taking one more look at some of the exercises we just went over, and we will move on. Okay, the push-pull ratio is also going to apply to our lower cross syndrome, with pushes being exercises that are knee dominant and really activate the quadriceps, and pulls being posterior chain dominant, activating glutes and hamstrings. And I've got that bowl of cereal there because I really envision our pelvis as being sort of like a bowl of cereal. We want that bowl of cereal neutral without the soup or the milk or whatever analogy you want to use spilling out the front or the back. But when our quads and our hip flexors tighten up out front, as they tighten up, they pull that bowl of cereal downward. And as that bowl of cereal gets pulled down in the front, it's going to tip upward in the back. So it creates a little traffic jam in your lower back. That's why your hamstrings might feel tight. And that's why when you stretch those tight hamstrings, it feels better for a little bit, but then it never actually gets better. Because if this is what your pelvis is doing with tight quads here and long elongated hamstrings here, if your hamstrings are already long and you stretch them out, what's going to happen? It's actually going to nurture the pelvis rotating even more, and then your hamstrings would feel even tighter. So it tends to be a vicious cycle. So what we want to do is activate our glutes, activate our abs, stretch our low back, and stretch our hip flexors and quads, right? If you guys can get good at resolving low back pain, right there, you've probably got a good career on your hands, because low back pain is the #2 reason in America that people go and visit the doctor. #1 is the common cold. And what's a double whammy? Okay, it's actually referring to the fact that when someone gets lower cross syndrome, they're more likely to develop upper cross syndrome, and vice versa. The reason for that being is that our body needs balance. When one joint complex is out of whack and off balance, and it's not like everything else is just going to be fine around it. You know, there's going to be consequences and repercussions. If that lordosis is occurring in the low back and hips, then to make up for that imbalance, kyphosis will likely occur around the shoulders and neck. Our body is just a big kinetic chain. Everything it's just a bunch of systems smashed in together. There's just such a domino effect and a ripple effect as things fall out of whack. You know, you want to get ahead of it. And what's really fun is that once you start having both of these issues, you also may develop patellar tendonitis. Doesn't mean if you have patellar tendonitis, you have one or two of those other issues going on, but these things happen. So our last area that I want to cover today is patellar tendonitis. And not only have I had countless athletes deal with patellar tendonitis, I also have had it myself. Several years ago, maybe more than several years ago. So in like early 20s, like age 23 to 24, I was doing a bunch of good training. I was getting nice and strong. And then all of a sudden, my knees started to hurt all the time. I couldn't even sit on the couch, sit in my car to drive somewhere without kind of moving funny and awkwardly to try to get down to try to skip some knee pain. And it took me about 1.5 years of learning. Probably did the learning on the last couple of months there before I started to resolve it, but it took me a long time. I was throwing money at anybody who would take it. I was going to see physical therapists. I was getting x-rays. I was getting MRIs. You know, the pain that this tendonitis was giving me, I couldn't believe it. You know, both knees would just bother me, and I thought there was something seriously wrong. And then using some of the principles that we'll discuss momentarily, I was able to resolve it. And using the strategies that helped me resolve it and that I've learned along the way, I have been able to help other individuals resolve theirs. But it's all anecdotal. It's just my personal experience. Take it with a grain of salt. Okay, so remember that our lower cross syndrome had tight quads involved in it. Well, those tight quads may be pulling your pelvis down, but at the same time, they may be causing additional strain downward, such as into your patellar tendon and over your kneecap. So that's one issue to consider, is that maybe it's a result of just tight quads or the issues that come with lower cross syndrome. Another reason why you might have patellar tendonitis, or what is called patellar tendonitis, would be a diagnosed issue, but patellar tendon pain can be called patellar tendinopathy. So with patellar tendonitis or patellar tendinopathy, one thing to consider is patellar tracking. So normally a healthy patellar tendon is going to exist, its movement is going to exist vertically, up and down, up and down. What's really common though, is that these big muscles, your vastus lateralis and your quad, your outside quad, is going to become so strong and active that that patellar tendon is actually going to start to bow out of its path a little bit here. And then our goal would be, if that's what's happening, we want to drive that patellar tendon activation inward by activating the vastus medialis. Not so that it comes inward, but just to correct it and get it back on its path. So in theory, here's what we'll be looking at. We'd want to inhibit that tight vastus lateralis. We want to inhibit some tight calves or grow our ankle mobility because the way that influences our movement and our squat patterns. A greater or more mobile ankle would allow us to better access our glutes and our hamstrings. The more you access your glutes and your hamstrings, the less you rely on your quads. What else is going to be weak is going to be our vastus medialis obliquus, or just VMO. Weak again would be our glute med, and weak would be our biceps femoris or our hamstrings. So some example exercises or movements. All right, so we want to inhibit our vastus lateralis. So that lateral quad muscle there. We want to inhibit our calves, which maybe we've got really low ankle mobility. It's very common. We want to start to strengthen that vastus medialis oblique, VMO, our glute med. We already talked about that glute med earlier for lower cross syndrome. Wouldn't you know it, there's some overlap in the issues, in the tissues that are causing issues. So, and I guess I snuck that glute max in here as well. So that's probably not going to hurt to just get the overall glutes more engaged. Biceps femoris being number 5. And why do we want to activate that biceps femoris? Again, the more the posterior chain is firing and performing, probably the less that quad is performing and being relied on, which would then allow that tendon to recover, relax, and get back on track. Okay, so for our patellar tendonitis, what do we want to inhibit? Well, again, because of just maybe generally overactive quads, but specifically that lateralis quad that might be pulling our patellar tendon laterally off the track that we want, I would start with a foam roll of that lateralis quad. So just simply getting your body weight down on that right there. If you want to make it extra painful or just mix it up, you can do some knee bends while you're in there. Oof, that hurts. I need to do more of that. If you're going to do that, I would advise 2-minute sessions, minimum of 2-minute sessions. So inhibiting that lateralis quad. What else we want to inhibit? Our calf. So just a half kneeling position. And we want to challenge that ankle mobility. Just hold it straight on, or you can change the angles a little bit. I like to say that the ankle needs angles. So if you're going to be an athlete and you're getting in awkward positions, some additional angles of stretching may benefit you. 2-minute sessions as well on that. The emphasis there is not only going to be improved ankle function, but also is that when our ankles are more mobile, it allows us to get in a better position in our squat patterns. So tight ankles, some people are, as soon as they start squatting, those heels are actually up. So once they start doing that, they're just really sitting on those quads and depending on that patellar tendon issue or patellar tendon area. If your ankles are mobile and they allow you to do a different type of squat where your heels are down and back, you can access more glutes and hamstrings. This reduces the wear and tear on your quads and your patellas. That's another reason that ankle mobility may benefit us if we're dealing with patellar tendonitis. So those are some things to inhibit. And when we start to activate, I would look at our VMO. We want to activate our glutes. We already talked about our glutes. And something else I'm forgetting. I'll check my cheat sheet in a second. All right, so our VMO. You want to get this little muscle inside your kneecap firing. Because as that lateralis muscle out here, sorry I don't have bigger quads to show off, as that lateralis muscle fires, it may be dragging that patellar tendon off track. And so by firing and activating this VMO muscle in here, it may influence that patellar tracking to get back into place and go where it needs to go. Really easy VMO activation exercise would be a single leg squat. And what I would do is I would send my whole body forward. My knee's going to go forward, but it's going to do it on a foot that is externally rotated. So not quite 45 degrees, but close. And everything's going to travel forward. Just that dainty little movement. We just want to activate it. We don't need to max out on it. We don't need to cause a disturbing amount of trauma and stress on it. We just need to convince it to get firing. Feel it stretch and strain on the front end, contract it and squeeze it on the back end, like you're flexing for a picture or something. Like you're trying to get that kneecap to lift towards you. Haven't done a whole lot of yoga in my life, but I had a yoga instructor talk about getting your kneecaps to lift up towards you. And I thought that was a great cue, and I stole it immediately. So from a different angle, that same leg, 45 degrees out, just about, and everything's going to travel forward. I'm going to pause at the top, and I'm going to squeeze that VMO. I'm also squeezing that glute, that booty cheek over here, because I want to lock into place. That VMO, now you might feel them on some big deep squats, but really that VMO is known for firing mostly in that last 15 to 30 degrees of extension of the knee. So that's your single leg VMO. Let me check my cheat sheet. We already talked about glutes. For our lower cross syndrome. So the same things would apply, is just getting them to fire, specifically that glute med for this problem. So fire hydrants would be great. You could band them, you can mix it up however you want. And then for patellar tendonitis, I consider just some hinging movements so that you can still train the lower body, such as an RDL, like a dumbbell RDL, like I'm performing now. That way you can still train the lower body, but you have less or no knee pain. So if it's you or your mom or an athlete or whoever has this patellar tendonitis, one of the greatest things I would encourage you to do would be to let those tendons rest, but don't stop training lower body. There's things that you can do. You can do RDLs. You can do hamstring curls. You can do calf raises, but you don't want the calves to get too tight again. So maybe you need to bounce out with additional calf stretching. But getting your body to move better may be the way to reduce your patellar tendonitis. Time spent sitting can be a problem because your hip flexors and your quads tighten up. I'm only 6 feet tall, so my knees come up this high. If I had an athlete in here sitting down who was 6'5" or taller, their knees might be up here or even higher. So right away, look at how their hip flexors would be tighter, right? A smaller angle there, tighter hip flexors. And then they get up and walk around and they have tighter hip flexors than maybe their sister or maybe a guy on a different team. And so maybe my wrestlers are not the tallest crowd, so maybe their knees are kind of down here a little bit, then their hip flexors open up. So I would say patellar tendonitis, watch out for a long bouts of extended sitting. Dr. Kelly Starrett, who I've kind of talked about a couple of times today, he would say well, he would say to read his book called Desk Bound, which is all about some of the dangers of sitting, which is not just orthopedic. It also affects our heart health and some of our mood and mental health as well. And then I would say, again, I had about 18 months of really challenging bilateral patellar tendonitis. And one of the things that I found that helped me out was long, slow incline walks on a treadmill. So around 15 or 20 minutes at an incline and just slow walking. And every step, what I would do is I would squeeze the glutes. As the leg was coming down, I would squeeze that glute. And I would keep squeezing that glutes until I got a quad and a hip flexor stretch at the bottom of that stride, or bottom of that step, excuse me. And then I'd take the next step. And my incline was probably around, it's been several years, but I recommend it to other athletes regularly. My incline was probably around 5%, and my speed was in like the upper 1s and low 2s. So, I might be doing this and not really even sweating, because it's all about changing the way that my body moves and what muscles are active and what muscles are inhibited. But this patellar tendonitis is also called jumper's knee, and it can cause athletes a lot of agony and a lot of trouble for long periods of time. So finding ways to get athletes to keep training, but just doing different movement patterns that are not bothering their knees and not just causing them pain, there's something to be said for that. So that's all I've got for today. Thank you guys for watching. If you have any questions, need anything, clarification on anything, please reach out. Okay, we'll see you next time.